So I see in your website that you have three kinds of lymphatic massage. You have post-op, you have Voder method, and you have Brazilian lymphatic drainage. Are those different? I also see that they have different prices. So what are the difference between them?
Oh yeah, so yeah, I have three lymphatic massage in my website, and they both of them are different to each other. So the post-op lymphatic massage is I use okay. So there are three stages of my of I created my post-op recovery care is I respect those three stages. So the first stage is the inflammation, second is the repair stage, and then the third is the remodeling stage. So most of the time the remodeling stage clients don't really care about that. So what they really care is the inflammation stage, because that's the time that's like they want to day 10 or 2 weeks. That's the time that they really swell up, like like they really need help, so they are miserable. So I usually see my clients 6 days consecutive in my package if they purchase the package, and then after that, so the focus on that one is like really try to get rid all of that fluid, right? But I do not do okay, I'm just gonna clarify this so everybody will know that I do not do incisional drainage. So what is incisional drainage? Incisional drainage is like when the therapist reopen, keep reopening the incision or the holes of the lipo, and then um forcefully drain the fluid. So I do not do that. I do not participate that practice. I am against with that, because I don't want my client to be in the excruciating pain. There is another way of for them to recover safely and without pain. Okay, so yeah, so I just need to put it that out there so they everyone will know that I am not participating that. So if any one of you ladies out there that can see this video that want to get lymphatic massage, I need to make sure that you guys know, if you're thinking like you want to come to Lymph in Motion, if you are here in Cedar Park, somewhere in the area, I need you to know that I do not do incisional drainage. And if that is what you're looking for, so I do not do that. That is risky, and I just don't participate on that. Anyway, so there are three stages: the inflammation stage, the repair stage, and the remodel stage. So inflammation stage, like day 1 to day 10, like we focus on voter method, and then the repair stage, and that's the time that if we need some tools like that we need to do. Like sometimes I do some kinesiotaping, lymphatic kinesiotape, and I put red light therapy, and also I do light cupping, silicone cupping. It's very gentle cupping. It's not rough at all. It's because it's very superficial. What we're doing is just like drain the fluid, right? And also kind of like break. And I also do fibrosis massages. So those are the things that involve in the post-op recovery session. So I also guide you with your positioning, your foam, what you need to do all the guidance and everything to get you a good recovery, right? Now, repair remodeling stage, most of the time my clients don't really bother that, but some of my clients do if they really care. So and then that is like the non-sculpting. Then we use the cavitation, radio frequency in the roller, and all that stuff. But now, another lymphatic massage. So the question is, do you have three kinds of lymphatic massage? So the post-op is the one that's like I focus on that one. So that's for the clients that has cosmetic post-op surgery, right? And they want to recover. So okay, that's what it is. It involves a lot of stuff. Okay, not just like a massage. It involves a lot of stuff. It's a little bit pricey. It's because I put all that together already. It's a little bit pricey. It's because it involves a lot of tools or a lot of focus on the session. Okay, and I also put you under the red light therapy in your session. Now, And it also takes me time to prepare your positioning, your table, and those stuff, especially for my clients that has BBL, tummy tucks. So your session, your positioning is different. Okay, each client is different depending on their procedure. So next is the other lymphatic massage that I have is Brazilian. Brazilian lymphatic drainage is great, but that is not for post-op. Okay, so it is it's kind of like aesthetic massage. Okay, aesthetic, it's like so let's say for example you want to go to the party and you want to fit into that little black dress of yours, so you'll get lymphatic massage. The Brazilian lymphatic massage is like give you that snatch look and then like instant, right? So that is Brazilian lymphatic drainage. Now, what is just a regular manual lymphatic drainage? Okay, so I use the Voder method manual lymphatic drainage, gold standard for chronic swelling decongestion. So I use that. That is like kind of like medical side, right? So my clients that come like inflammation stage, that's what I use, the Voder method. And then I kind of like after that, when we get into repair stage, and we kind of like use the fibrosis massages, and then if they're ready, I apply a little bit of Brazilian here and there. So I mix it up, the modality. Okay, so Voder method, it is great for lymphedema patients, patients that had mastectomy, or patients that has lymphedema because of breast cancer or any type of swelling, chronic swelling, have a chronic, what is this? Chronic venous insufficiency. I can't pronounce it anymore. So that's what I use, the Voder method. So if I have clients that going through lymphedema, so I am also a certified lymphedema therapist, so I use the CDT. CDT, what is CDT? CDT is completely congested therapy. So we will use the multi-layer bandaging. So that is CDT, and it, of course, it involves skincare, remedial exercise, manual lymphatic drainage, and there's phase 1 and phase 2. So for CLT that's watching this video, you know what I'm talking about, right? So that's the reason why I have 3 lymphatic drainage. They have their own purpose. They are not the same. Manual lymphatic drainage is Voder method. That's what for like chronic swelling, lymphedema, like CVI and lipedema. Okay. Now it's gentle, dry. We do not put. Well, if the client is fibrotic, and then we do a little bit of like fibrosis here and there, but most of the time we're very gentle. Now, Brazilian is aesthetic, and post-op is, I already explained it earlier, it involves a lot on that one, not just Voder method or Brazilian lymphatic drainage. And I also added my own method, and I call it a lymphofascia technique, because I needed that. I created that method. It's because it's very helpful. I found it very helpful when I care my post-op clients. So that is my explanation to that questions. Why do you have 3 kinds of lymphatic massage? So I hope this answers the questions out there. See you soon.